You can't buy security by acquiring technological artefacts.
I really think inside the Department of Health, they don't see there's a problem.
Denying criminals the use of the roads will tip over, or is tipping over, into blanket surveillance.
Last year's database state report showed massive problems in the way that government collects and stores data about us. They showed that many government databases are illegal, insecure, and pose huge privacy threats. The Open Rights Group followed this up with a series of expert seminars looking at the way that data is used about our children, crime, transport and health.
Those who ran the DNA database didn't see a problem coming. They then had the Mapo Judgement. Now they're in a complete tailspin trying to work out what to do about it. And I think around Connecting for Health, people are in the same sense of denial or fool's paradise, really, about whether what they're doing is sustainable legally. We had an indication that there's a change in mood or spirit coming down the track with the likelihood of a different administration in the new year, but it's going to need to be a very concrete and substantial change, and it's going to need to be supported by the officials involved in a much more concrete and urgent way than we've had any sense of.
This summer I was asked to my delight, to take part in a consultation about how to consult patients on a new system called the General Practice Extraction Service, GPES, about which I think we'll hear more. And what this system is going to do, and there's work well advanced on it already, is extract data from patients' records held in their general practice. Already, there are a queue of 20 customers who are waiting to make monthly extractions from GP patient records on certain aspects of data.
Even more worrying, however, is the lack of transparency, lack of legislation or even regulation in some instances when networks such as the automatic number plate recognition camera network are rolled out, expanded, brought under poorly scrutinised centralised control and connected to increasing numbers of linked databases. It's also the case that the selling of DVLA data, private companies, even criminals, is also corrosive of trust. You know, turning your buck from, or million buck from data that you hold is hardly a good way to be seen as a trusted guardian. A line must be drawn between warranted requests and searches for actual suspects, and the sort of blanket exemptions that are now sometimes being given, such as the Home Secretary providing with a national security certificate for live access to the London congestion charging system.
In the course of the database state seminars, the Open Rights Group developed 4 principles to help return trust to these disgraced systems. The first is to minimise data, to only collect what data is necessary. The second is to share data only when proportionate and necessary, not on a whole-scale basis. The third is to give data subjects ownership and control of their data, so they are able to correct mistakes and to take their data out of systems when they wish. And the fourth is to build for anonymity, that is, to allow people to join these systems and remain anonymous when they feel they need to.
That was a very positive discussion because there was a general acceptance that the principles were the right ones. What was very hopeful was the agreement that there needed to be a firm position for all databases of legislative background, and that legislative background should not come about except after proper consideration of the principles by Parliament, so that new databases, and for that matter all existing ones, should have gone through that process and should therefore be justified on the proportionate and necessity grounds.
Too much of the concentration in these large IT projects tends to be on the simple things that you can do to ensure security, such as buying smart card systems or investing in some kind of secure network. In fact, a lot of the early adopter sites that we spoke to in the course of our study, the representatives there said that they felt reassured that Connecting for Health was focusing on technological systems that would ensure that patient records remain secure. But despite this sort of technology, despite sign-on, despite secure networks, patients' records will still be accessed and that information divulged inappropriately. For example, we've seen in December 2008 in Scotland a a number of patients' records were accessed inappropriately by a doctor. Among those patients were Alex Salmond and Gordon Brown and some early morning news broadcasters on Scottish television. The only reason we know about that is that the Scottish system informs the patient when their emergency care summary is accessed. In England, with the system that we have, as patients, we would never know whether or not our records are being accessed inappropriately. So because technology can't save us, because there will be people who have legitimate access to the system but make illegitimate use of the data, we need to ensure that there are proper methods of detection, of deterrence and of sanction when we find out that these records are used inappropriately. And we as data subjects, as the patient, have every right to know when our records are used and who by.
The findings you've just heard are sometimes shocking and sometimes hopeful. Our MPs and their advisors hold an enormous responsibility to regain the trust of the public, which has been sadly lost. Visit our website to find out more about what you can do.
We've got a long way to go. I really think we're just at the beginning of this.